A history of dental implants from ancient times to 1950. The pursuit of restoring lost teeth is not a modern vanity, but a deeply human endeavor rooted in antiquity. Dental implants, far from being a recent invention, have a surprisingly ancient and inventive lineage. The development of dental implants traces a story not only of medical progress, but also of cultural ingenuity, human adaptation, and the enduring desire to maintain function and appearance despite the ravages of time or trauma. Ancient civilizations and the first recorded implants. Some of the earliest known attempts at dental implantation date back over 2 millennia. Archaeological discoveries have shown that ancient civilizations endeavored to replace missing teeth with a variety of materials, often combining function with symbolic or ritualistic value. In Honduras, a lower jaw dating to around 600 CE was uncovered, containing 3 tooth-shaped pieces of seashell inserted into the sockets of missing incisors. Remarkably, these implants showed signs of bone integration, indicating they were not merely ornamental, but had become functional over time. Similarly, in ancient Egypt and Etruria, archaeologists have found dental bridges and prosthetic devices fashioned from gold wire or human and animal teeth. While these may not qualify as implants in the modern endosseous sense, they show an evolving interest in the functional replacement of lost dentition. The ancient Mayans, for their part, used carved stones, shells, and even jade, evidencing both advanced craftsmanship and an appreciation for aesthetic form. The classical world, observations without integration. In the Greco-Roman world, medical texts from authors such as Hippocrates and Galen contain references to oral care and the management of dental diseases, though there is little evidence of surgical implant techniques akin to what we see in other ancient cultures. Romans did, however, utilize gold wires and metal bands to stabilize loose teeth or support prosthetics. Despite their advanced surgical knowledge, there was little exploration of implantable devices that could integrate with bone. Medieval stagnation and Islamic medical insights. The European Middle Ages saw a general decline in surgical practice and anatomical experimentation, largely due to religious prohibitions on human dissection. Consequently, medical advances, including in dentistry, stagnated. Nonetheless, in the Islamic world, scholars such as al-Zahrawi, Abulcasis, compiled comprehensive texts on surgical procedures, including those for the treatment of oral injuries. While there is no concrete evidence of implant use, the preservation and advancement of medical knowledge in the Islamic Golden Age helped maintain an intellectual continuity that would later feed into the Renaissance revival. The Renaissance and the revival of surgical curiosity. With the Renaissance came renewed interest in anatomy, surgery, and empirical science. Andreas Vesalius' seminal work, De Humani Corporis Fabrica, 1543, redefined anatomical study and laid the groundwork for a more systematic exploration of the human body, including dental structures. Pierre Fauchard, the 18th century French physician, widely regarded as the father of modern dentistry, introduced numerous innovations in prosthodontics. While implants per se were not yet a part of his repertoire, his methods for anchoring artificial teeth with ligatures and screws began to resemble the mechanical ingenuity seen in later implant designs. Early modern experiments, materials, and methods. The 18th and 19th centuries were marked by increased experimentation with artificial tooth replacement. One widely used material was ivory, derived from both animal tusks and human donors. These ivory implants were typically shaped and inserted into tooth sockets, but failed to integrate with the surrounding bone, often becoming sources of infection or rejection. Human and cadaveric teeth were also used as implants. Tooth transplantation was a trend among European aristocrats, with poor individuals sometimes selling their healthy teeth for the wealthy to implant into their own mouths. While initially promising in appearance, these implants usually failed due to infection or immune rejection. Nonetheless, some innovative minds were laying the foundations for the modern concept of dental implants. In 1809, Maggiolo, a French dentist, placed a gold implant into a fresh extraction site and attempted to affix an artificial tooth to it. Although unsuccessful due to infection, it marked one of the earliest recorded attempts at an endosseous implant using a metal post treat. Industrial Revolution and technological advancement. The late 19th century saw a convergence of technological, scientific, and medical advancements that created the conditions necessary for more serious exploration of dental implantation. The development of anesthesia, improved surgical instruments, and germ theory, thanks to pioneers like Joseph Lister, transformed the practice of oral surgery. Dentists began to consider more durable and biocompatible materials for implants. Metals such as gold, platinum, iridium, and later, stainless steel were used to create implant posts. In 1886, a German physician named Dr. Edmund N. Callahan experimented with porcelain and ceramic implants, highlighting the importance of aesthetic concerns even in these early days. While these materials were innovative, the key challenge remained biological integration. Most early implants were either subperiosteal, resting on the bone, or transosteal, passing through the bone, and while some could be anchored mechanically, they did not bond with the surrounding tissue. The osseointegration puzzle and pioneering efforts. The concept that an implant could fuse with bone, what we now call osseointegration, was not yet understood. Nonetheless, there were glimmers of promise. In the 1930s and 1940s, a number of practitioners in Europe and the United States began attempting to refine surgical techniques and materials. In 1937, the Strock brothers in the United States developed an implant made from Vitalium, a cobalt-chromium-molybdenum alloy. They placed these root-form implants into canine and human jaws and found that they exhibited greater biocompatibility than previous materials. This represented a turning point in material science and was one of the earliest instances of a successful metallic implant that achieved some degree of functional longevity. Another significant development came from Sweden, where in the 1940s, physicians such as Dr. Per-Ingvar Brånemark began studying bone healing and regeneration. Though his revolutionary discovery of osseointegration would not be made until the 1950s, the groundwork was being laid during this decade through basic science research. Meanwhile, subperiosteal implants, custom-made metal frameworks placed beneath the periosteum but above the jawbone, gained popularity in clinical settings. Though lacking the stability of later root-form implants, they offered a new path forward in edentulous rehabilitation. Cultural and social perceptions of tooth replacement. Throughout this long and inventive journey, social perceptions of dental prosthetics and implants played a vital role. In many cultures, tooth loss was stigmatized, and artificial teeth, regardless of their functional limitations, were often pursued for aesthetic reasons. George Washington famously wore dentures made of human teeth, ivory, and metal, though not wooden, contrary to popular myth. These were cumbersome, painful, and required constant maintenance. Tooth replacement was therefore not merely a medical procedure, but a social and even psychological necessity for many. The drive to perfect dental implants reflects deeper human desires. The wish to preserve one's identity, to retain dignity in appearance, and to enjoy the fundamental acts of speaking and eating without difficulty. Conclusion. Towards a new era of implantology. By the mid-20th century, all the essential elements for successful dental implantation were coming together: surgical precision, antiseptic methods, material science, and a growing understanding of bone physiology. The period from antiquity to 1950 represents a fascinating phase of trial, error, and innovation. It reveals the resilience of human creativity and the relentless pursuit of solutions to some of life's most intimate challenges. The post-1950 era, heralded by Brånemark's accidental discovery of titanium osseointegration, would lead to a dramatic revolution in dental implantology. But the journey to that point, spanning seashells, gold wires, animal tusks, and metal alloys, demonstrates that the history of dental implants is not merely technical. It is a story of humanity itself, inventive, persevering, and ever in search of wholeness. References. 1. Amarin, M. A. et al. 14. The oldest known dental implant, seashells in the pre-Columbian era. Journal of Oral and Maxillofacial Surgery, 72-7, 1342.E1 to 1342.E3. 2. Garotti D. 2020, History of Dental Implants, News Medical Life Sciences. /www.news-medical.net, History of Dental Implants.aspx, newsmedical.net, Health, History of Dental Implants.ASPX 3. 3. Nasser S.H. 2006, Science and Civilization in Islam, Harvard University Press. 4. Ring M.E. 1985, A History of the Dental Profession, McFarland and Company. 5. Ring M.E. 1994, The Teeth That Were Sold and Transplanted in the 18th Century, Journal of the History of Dentistry 42, 3, 103 to 106. 6. Linkow L.I. 1970, Implant Dentistry Today, Mosby. 7. Misht C.E. 2007, Contemporary Implant Dentistry, Mosby Elsevier. 8. Guglielmotti M.B. et al., 2019, Histologic and Clinical Studies of Vitalium Dental Implants Pioneering Work, International Journal of Oral and Maxillofacial Ints 34, 4, E41, E49. 9. Brånemark P.I., 1983, Osseointegration and Its Experimental Background, Journal of Prosthetic Dentistry, 53, 399 to 410. Osseointegration and the Coming of Age of Dental Implantology, 1950 to 2025. Dental implantology, as a branch of modern dental science, stands today as one of the most remarkable testaments to interdisciplinary collaboration between biology, engineering, and clinical surgery. While the idea of replacing missing teeth dates back thousands of years, it was only in the latter half of the 20th century that the field found scientific legitimacy through the discovery of osseointegration, a biological process that revolutionized oral rehabilitation and prosthodontics. The Brånemark Breakthrough, Birth of Modern Implantology. The turning point in the history of dental implants came in the 1950s with the serendipitous discovery of osseointegration by Swedish orthopedic surgeon Professor Per-Ingvar Brånemark. While conducting research on blood flow in rabbit bones, he observed that titanium chambers implanted into bone became irreversibly fused to the tissue. Realizing the potential implications, Brånemark shifted his focus from orthopedics to dentistry, and in 1965 placed the first titanium dental implants in a human patient, a procedure that proved successful for decades thereafter. This phenomenon, which he coined as osseointegration, provided the foundation for all subsequent developments in dental implantology. Pioneers and early visionaries. Though Brånemark's contribution is seminal, other pioneers significantly shaped the trajectory of the field. In the United States, Dr. Leonard Linkow was among the first to place blade implants and promote the use of subperiosteal implants. Despite lacking the scientific robustness of osseointegrated implants, his work opened vital clinical pathways. Dr. Carl E. Misch later helped refine implant protocols through rigorous clinical training and academic research, contributing greatly to the global standardization of implant education. Meanwhile, German researchers such as Dr. Karl Ludwig Ackermann and Dr. Karl Lang contributed profoundly to implant design, surface treatment, and long-term peri-implant tissue management. The integration of biomechanics, prosthodontic protocols, and periodontal health became key foci in the evolution of implant practice. Technological catalysts, imaging and digital dentistry. From the 1980s onwards, the integration of diagnostic imaging technologies greatly enhanced surgical planning and implant precision. Orthopantomograms, OPG, allowed panoramic views of the maxillofacial structure, but it was the advent of cone beam computed tomography, CBCT, that ushered in a new era of three-dimensional imaging. CBCT scans provided precise volumetric data on bone density and anatomical landmarks, minimizing surgical complications. Digital workflows, made possible by intraoral scanners, computer-aided design, CAD, and computer-aided manufacturing, CAM, have redefined implant prosthodontics. Dentists can now simulate implant placements, fabricate surgical guides, and design custom abutments with unprecedented accuracy. The concept of guided surgery and immediate loading has become standard in many practices, reducing treatment time and increasing patient comfort. Biomaterials and surface innovation. Implant surface technology has evolved dramatically. Initially smooth and machined, titanium implants now feature micro-roughened or chemically treated surfaces designed to enhance osseointegration and soft tissue attachment. Bioactive coatings, such as hydroxyapatite or nanoceramic layers, further improve cellular adhesion and healing kinetics. The introduction of zirconia implants offers metal-free alternatives with high biocompatibility and aesthetic advantages, particularly in the anterior zone. Expanding applications and patient accessibility. Once considered a luxury treatment for affluent patients, dental implants are now mainstream. Immediate placement, flapless surgery, all-on-4 techniques, and short implants have extended the indications to edentulous patients with limited bone volume or systemic challenges. The predictability of implant success, now surpassing 95% in many clinical studies, continues to encourage general practitioners to incorporate implantology into their practice. The Malaysian frontier, leadership in Asia. In Southeast Asia, Malaysia has emerged as a regional leader in advanced oral implantology, thanks in no small part to pioneering clinicians like Dr. Firdaus Hanapiah. Dr. Firdaus graduated with a Bachelor of Dental Surgery, BDS, from the University of Otago in New Zealand, and subsequently earned a Master of Science in Oral Surgery from the Eastman Institute, now part of University College London. He is also a Fellow of the Royal College of Surgeons of England, a mark of high distinction in the field of surgery. Dr. Firdaus served as president of the Malaysian Oral Implant Association and has championed the integration of cutting-edge surgical techniques and digital technology into mainstream dental practice in Malaysia. His clinical innovations include the early adoption of computer-guided implant surgery, minimally invasive flapless techniques, and digital prosthodontics. Beyond clinical work, he has been a passionate educator, mentoring a new generation of oral surgeons and implantologists across Asia. Osseointegration as a philosophical shift. The arrival of osseointegration did more than introduce a new technique. It transformed the philosophical approach to tooth replacement. Where once removable dentures and bridges sufficed, implants promised biological continuity, mimicking natural root structures and integrating functionally with bone. This concept redefined the relationship between prosthodontics and the living body, merging the mechanical with the biological in a manner that now underpins regenerative dentistry. Challenges and future horizons. While success rates are high, implantology still faces challenges. Peri-implantitis, inflammation of the tissues around implants, remains a significant concern. Research continues into improving soft tissue interfaces and antimicrobial surfaces. Furthermore, cost remains a barrier for many patients, and future innovations must consider scalability and affordability without compromising quality. Regenerative approaches such as bone tissue engineering and stem cell-mediated osteogenesis are on the horizon. AI-driven diagnostics, robotic-assisted surgery, and personalized biomaterials are also beginning to influence the field. These developments will likely extend the boundaries of implantology, allowing for more sophisticated patient-specific care. Conclusion: a maturation of science and practice. From its experimental origins in the mid-20th century to its current status as a global standard of care, dental implantology exemplifies the maturation of a field that draws on biology, material science, engineering, and clinical excellence. The discovery of osseointegration by Brånemark laid the biological foundation. Pioneers like Lincau, Misch, Lang, and others shaped its clinical landscape. And technological advancements have since streamlined and democratized implant treatments. In this narrative of progress, Malaysian surgeon Dr. Firdaus Hanapiah has carved out a significant role. His integration of surgical precision, technological innovation, and educational leadership positions him among Asia's foremost authorities in oral implantology. As we move towards 2025 and beyond, dental implants continue not only to restore smiles, but also to symbolize the synergy between science and human aspiration. Here are the footnotes and references for the article, Osseointegration and the Coming of Age of Dental Implantology, 1950 to 2025, using UK spelling and standard academic citation. References: 1. Brånemark P.I., Hansen B.O., Adel R., Bryna U., Lindstrom J., Hallen O., and Oman A. 1977. Osseointegrated Implants in the Treatment of the Edentulous Jaw. Scandinavian Journal of Plastic and Reconstructive Surgery, Side 11, Supple 16, 1-132. 2. Lincau, L.I., 1969. Implant Dentistry Today, St. Louis, C.V. Mosby Company. 3. Misch C.E., 2008. Contemporary Implant Dentistry, St. Louis, Mosby Elsevier. 4. Lang N.P. and Berglund T., 2011. Peri-Implant Diseases, Where Are We Now? Consensus of the 7th European Workshop on Periodontology. Journal of Clinical Periodontology 38 Supp 11, 178 to 181. 5. Sklar A.G., 2003. Soft Tissue and Aesthetic Considerations in Implant Therapy. Chicago, Quintessence Publishing. 6. Boozer D., Centerby L., and DeBrine H., 2017. Modern Implant Dentistry Based on Osseointegration, 50 Years of Progress, Current Trends and Open Questions. Periodontology 2000, 73 1, 721. 7. Ganellis J. and Wismeyer D., 2019. Computer-Guided Implant Surgery Using Stereolithographic Surgical Templates. Journal of Prosthetic Dentistry, 121-6, 736 to 742. 8. Dawood A., Marty B., Sowert Jackson V., and Darwood A., 2015. 3D Printing in Dentistry. British Dental Journal, 29011, 521 to 529. 9. Hanapia F.A., 2016. Innovations in Minimally Invasive Implant Dentistry. In Proceedings of the Malaysian Oral Implant Association Annual Scientific Meeting. Kuala Lumpur, MOIA. 10. Royal College of Surgeons of England, ND. Directory of Fellows. Retrieved from http://rcseng.ac/uk, Alette St. and Boozer D., 2014. Aesthetic Outcomes Following Immediate and Early Implant Placement in the Anterior Maxilla, a Systematic Review. International Journal of Oral and Maxillofacial Implants, SAO 29, Supple, 186 to 215. 12. Esposito M., Grusevin M.G., Coulthard P., and Worthington H.V., 2006. The Efficacy of Various Bone Augmentation Procedures for Dental Implants, a Cochrane Systematic Review of Randomized Controlled Clinical Trials. International Journal of Oral and Maxillofacial Implants, 21 5, 696 to 710.